a 7th Star Media production. Hello, and welcome. I'm Dr. Sanjay Gupta. Each year, as the seasons change, a familiar and formidable challenge arrives. Influenza, or as most people know it, the flu. This viral illness is a significant public health concern across the globe, causing millions of cases, hundreds of thousands of hospitalizations, and tens of thousands of deaths annually. For healthcare professionals, particularly nurses working in outpatient settings, the flu season represents a period of increased patient volume and clinical complexity. Understanding this common adversary is the first and most critical step in managing its impact effectively and protecting our communities from its potentially severe consequences. Influenza is not just a bad cold, it is a serious respiratory infection caused by a highly contagious virus that can lead to severe complications. Its ability to change and evolve from year to year means that our immunity, whether from a previous infection or vaccination, can become less effective over time. This constant evolution is why we see recurring seasonal epidemics and why a new vaccine is needed each fall. For nurses on the front lines in clinics, urgent care centers, and physician offices, being prepared with the latest knowledge is not just beneficial, it is absolutely essential for providing high-quality patient care and ensuring patient safety during these demanding months. This educational session is built to be a rapid yet comprehensive briefing, designed to fit into your busy schedule. We will cover the essential information you need in about 15 minutes. Our primary goal is to empower you, the outpatient nurse, with the confidence and knowledge to navigate the challenges of flu season. We will delve into the fundamental nature of the influenza virus, exploring its different types and how it spreads so efficiently through our communities. We will focus specifically on the information that directly impacts your daily practice, from initial patient contact to final patient education, helping you make a real difference. This guide will focus on 4 key pillars of outpatient nursing care. Pillar 1. Sharpen your ability to recognize signs of influenza. Classic signs. Atypical signs. Pillar 2. Clear triage criteria. Who can be safely managed at home? Who requires a higher level of care? Pillar 3. Outpatient management strategies. Symptomatic relief. Appropriate use of antiviral medications. Infection control within the home. Pillar 4. Patient education. Communicate with clarity and empathy. Importance of vaccination. Dispelling common myths and misconceptions. To effectively combat the flu, we must first understand the virus itself. Influenza is not a single entity, but a family of viruses in the Orthomyxoviridae family. There are 4 distinct types: Influenza A, Influenza B, Influenza C, and Influenza D. While all can cause illness, they differ in structure, hosts, and impact on human health. For nurses, the most important are Influenza A and B. A and B cause the vast majority of seasonal epidemics. Influenza A is found in many animals: ducks, chickens, pigs, whales, and humans. That wide host range makes A volatile and pandemic capable. Influenza B circulates almost exclusively in humans. Influenza C is milder and causes cold-like illness, not epidemics. Influenza D mainly affects cattle and is not known to infect humans. Now let's zoom in and look at the structure of the influenza virus. On the surface of this sphere are 2 critically important proteins that act like keys: hemagglutinin, or HA, neuraminidase, or NA. These proteins give influenza A its subtype names, such as H1N1, H3N2. HA is the key the virus uses to enter a host cell. HA's shape lets it bind to receptors in the respiratory tract, like a key in a lock. Once attached, HA triggers the cell to engulf the virus. After replication, the virus needs to get out and spread. NA acts like molecular scissors. NA cuts new virions free from the infected cell surface. Clinically, HA and NA matter. Antivirals like oseltamivir target NA. Annual vaccines train our bodies to make antibodies that recognize and neutralize HA and NA from predicted strains. The primary mechanism behind these small, continuous changes is called antigenic drift. Think of antigenic drift as a slow, gradual accumulation of minor errors. Every time the virus replicates its RNA, it can make small mistakes, mutations. Antibodies from a previous infection or from vaccination might not bind as tightly to the new drifted virus. That partial mismatch helps the virus evade immune defenses and cause infection. Antigenic shift is an abrupt, major change in the virus's surface proteins. It happens when an influenza A virus from an animal infects a host at the same time as a human influenza A virus. Inside the host cell, the virus's genetic material can be reassorted. That genetic mixing can create a completely new hybrid influenza, a subtype. A novel HA means most people have little to no pre-existing immunity. That vulnerability can let the virus spread widely, triggering a pandemic. The primary mode of transmission is through respiratory droplets. A second important mode is through contact with contaminated surfaces. There is also growing evidence for aerosol or airborne spread. The incubation period is the time from exposure to symptom onset. For influenza, it's short, typically 1 to 4 days, average about 2 days. The contagious window is when an infected person can spread the virus. For most healthy adults, it opens about 1 day before symptoms begin. The peak of contagiousness is the first 3 to 4 days of illness. Some people can shed the virus for longer. Young children, individuals with weakened immune systems. They may be contagious for 10 days or longer. While anyone can get the flu, certain groups are at much higher risk of serious complications. As an outpatient nurse, quickly identify high-risk individuals. Very young, infants and children under 5 years old. Adults age 65 and older. Immunosenescence, age-related immune decline. Pregnant people. Flu vaccination is strongly recommended and safe in any trimester. People of any age with chronic medical conditions are also high risk. Asthma, heart disease, diabetes, and people who are immunocompromised. When a patient presents with influenza, they often describe a classic set of symptoms that come on suddenly. The most common symptoms include a high fever, a persistent, non-productive cough, severe muscle or body aches, and a pounding headache. In the elderly, classic fever and body aches may be absent. Older adults may present with confusion, dizziness, loss of appetite, or a sudden decline in function. Keep a high index of suspicion during flu season. Young children can also present atypically. They often have high fever but may show more GI symptoms like nausea, vomiting, or diarrhea. In infants, signs may be nonspecific: irritability, poor feeding, or lethargy. The common cold typically has a gradual onset with upper respiratory symptoms. High fever and severe body aches are rare. Influenza causes debilitating fatigue. Comparing influenza to COVID-19 can be tricky. Both commonly cause fever, cough, fatigue, and body aches. One distinguishing feature of COVID-19 can be the sudden loss of taste or smell. Use a mental checklist: onset speed, presence and height of fever, severity of myalgia, and loss of taste or smell. This forms a working diagnosis while awaiting tests. The most critical red flag is any sign of respiratory distress, shortness of breath, rapid breathing, or use of accessory muscles. In children, you might see nasal flaring, grunting, or retractions. A reading below 94% on room air is a significant red flag. Equally concerning is any change in mental status. This can manifest as confusion, disorientation, or unusual lethargy. Signs of severe dehydration are another critical warning sign. In adults, look for dizziness upon standing. In infants, red flags include a significant decrease in wet diapers and crying without tears. Once you have identified one or more red flags, the next step is to initiate a clear escalation of care. The decision to call an ambulance is reserved for clear life-threatening signs. For a patient who can be safely managed at home, the cornerstone is effective symptomatic care. Emphasize rest. Advise them to drink plenty of fluids. For fever and myalgia, recommend OTC antipyretics and analgesics. A key decision is whether to recommend antiviral medication. Antivirals are most effective when started within 48 hours of symptom onset and are strongly recommended for high-risk patients. Advise the sick individual to isolate themselves as much as possible. Instruct everyone in the household to wash their hands frequently and to regularly clean and disinfect high-touch surfaces. One common myth: the flu shot can give you the flu. Explain clearly, that is impossible. The injectable flu vaccine is made with an inactivated, killed virus, or with a single protein from the virus. Neither can cause infection. When patients report feeling unwell, explain it's the immune system's normal, healthy response. Frame these symptoms as a positive sign that the body is building protection. Use an analogy. A seatbelt doesn't prevent all car accidents, but it dramatically reduces your risk of serious injury. The flu shot works in a similar way, preventing severe illness, hospitalization, and death. Your clinical compass: knowing the virus, watching for red flags, acting fast for the vulnerable, using treatments wisely, and teaching prevention. Let this guide you through flu season with confidence and expertise. But beyond protocols lies the true art of nursing. Your calm, evidence-based presence is itself therapeutic. Patients look to you for reassurance and safety. Thank you for your time and dedication. Stay safe, stay informed, and continue to make a remarkable difference. This is for educational and informational purposes. This is not medical advice. Please see your primary care physician for any questions you may have. Stay safe, please like and hit the subscribe button for more skill tree nursing information.